Hi, and welcome to the Resilience webinar. Resilience, what it is and why does it matter? I'm Casey Peluso of Parkinson Foundation, Western Pennsylvania, and we're joined by David Von Hofen and Christine Haythorne.
Hi, everybody. It's good to see you.
Yeah, it's great to see everyone. As I mentioned, this will be recorded and you'll be muted during the presentation. And there will be time to ask questions using the chat feature during and the chat feature at the end, or you can verbally ask questions at the end. I would like to thank our sponsor, Amneal Pharmaceuticals. And now I would love to introduce Dr. Bradley Mcdaniels. Dr.
Again.
McDaniels, yes, he's back. He
Round
presented
two.
on apathy, one of his areas of focus. And I had asked him about resilience, and he said, sure. So thank you. Dr. McDaniels is the assistant professor and coordinator of the Rehabilitation Studies program in the Department of Rehabilitation Services at the University of North Texas in Denton, Texas, north of Dallas. Prior to joining the University of North Texas, Dr. McDaniels earned his PhD from the University of Kentucky in rehabilitation counseling. Then he accepted an advanced rehabilitation research and training postdoctoral fellowship appointment with focus on Parkinson's disease at Virginia Commonwealth University. Dr. McDaniels is also personally affected by Parkinson's, as his mother was diagnosed nearly 9 years ago. This motivated him to pursue graduate studies and current research. Dr. McDaniels' current research interests include positive psychology, psychosocial adaptation, quality of life, meaning in life, and apathy in Parkinson's disease. Welcome, Dr. McDaniels, and please take it away.
Thank you for the kind introduction, Casey. I appreciate that. If you would, before I forget, can you give me permission to share, please?
Yes, I knew I forgot something.
I forgot to ask you at the beginning.
Okay. Sure. 1 second. Okay.
Yep, that does it.
Great.
Do it here. All right. So I'm grateful to be back with you guys. It was apparently I didn't do too poorly of a job the first time that I wasn't written off the list of potential speakers again, but I always enjoy doing this. You know, one of the things that Casey mentioned at the beginning is the fact that my mom has PD, and that has been the driving force behind everything that I do. It's made me much more acutely aware of the challenges faced by people with Parkinson's disease. And, you know, she talked about all of my research interests. At the end of the day, my research interest is to make people's lives with Parkinson's disease better. It's that simple. And what does that look like? It looks like a lot of things. And, you know, we really try to just pick up a couple little things along the way and say, maybe we can do these one or two things and life will become better. So that's kind of what I've done. And I've spent time looking at apathy and the role that it plays in Parkinson's disease and how we might be able to mitigate that or reduce its effects. And Casey asked me about resilience. And yeah, so I haven't done a ton with resilience, but I am doing some work with post-traumatic growth, which, as we'll talk about, they are very closely related constructs and really are essential to well-being for people with not only Parkinson's disease, but any type of adversity that one faces in life. So we're going to roll through these things, talk a little bit about what they are, why they matter. Can you improve resilience? And what does it look like trying to do that? What are some strategies that you can implement in your daily life that might help you become more resilient? So that being said, we will kick off. Does resilience matter? Yes, of course it matters. If it didn't, we would be spinning our wheels. trying to talk about this. According to the World Health Organization, they do an update every couple of years. And the last one they did, Health 2020, specifically mentioned resilience. And they said resilience and supportive environments are necessary for people to thrive. I think largely the medical community understands resilience. Certainly the community of psychologists, counselors, psychiatrists, undoubtedly understand the value of someone having a resilient mindset. So there's clearly a lot of support for this, and a lot of research done in this area. Oh, it is telling me, let's see. All right. Oh, back up. So why does it matter, right? If you go through the literature and you talk about resilience, it's been associated with a myriad of positive outcomes: better rated health, lower mortality, decreased cognitive impairment, slower physical decline, less anxiety, depression, stress, apathy, improved quality of relationships, et cetera, et cetera. And the literature is clear that there's definitely, we won't say that there's a cause and effect relationship, but there's certainly a correlational relationship, which means that one influences the other. And, typically when I mention something like this, if I were watching this slide, I would say, yes, that's great. But what about for people with Parkinson's disease? Does resilience work? Yes, it does. Many of the same things that I just mentioned, you find in the research that's been done. And it's, on a side note, the research in Parkinson's and resilience is extremely limited. There really hasn't been much done looking at it, and it's certainly something that deserves a little more attention than what it's gotten thus far. So people with PD report less disability, better health-related quality of life, lower non-motor symptoms, more positive outlook, optimism, less pessimism. Many of the things that I think some of you may be able to say, wow, those things make a difference in my life. Anytime we can have a more optimistic outlook on the way things are going in our lives, typically the better they go and the better we feel. So that's kind of just to give you the rundown of why do we even talk about resilience? Because to me, we need to qualify whether or not something's important before we begin to address it. And the last bullet point, there's health is not simply the absence of disease, but it's also the presence of wellness. So one of the things that we'll talk about in a couple of slides is positive psychology and what that is, and how is that different from the psychology that some may know or may have heard of in the past. So we'll address some of that. So this is an interesting slide. This is done by George Bonanno. He is he is one of the top thought leaders when it comes to resilience and understanding the role that it plays in health. And it's kind of a busy slide, so I'm just going to walk you through what it says. So if you look along the y-axis, which is on the left, the vertical axis, that's got health and dysfunction. So the higher you go on that y-axis, the more dysfunction you have in your life. The lower you go, the more healthy you are. So clearly, just by that, you want to be the lowest line on this chart to be the most healthy. And so what he's got, PTE, which is right at the intersection of the X and the Y axis, is any type of a traumatic experience. And it can be any type of adversity, something that happens in your life that is really difficult to deal with. And largely what we're talking about here is the onset of a chronic illness, i.e. Parkinson's disease. So what he looked at in his data, this is back in 2011, so it's fairly new in the resilience world. And he looked at people who have an event that happens that is traumatic and it remains chronic. You can see there along the very top, the issues that are associated with that event don't go away. They don't get better. It's just something that you live with in a steady state indefinitely. And those are about 5 to 30% of all people who experience something that's adverse. And clearly you can see, according to this chart, their dysfunction is going to be the highest. And then as you move down the page, you'll find the line that's recovered, that starts up higher and then it drops down. That would be someone who is diagnosed with, let's say, something like cancer, right? And you get that diagnosis and there's a lot of trauma associated with that. But over time, maybe it goes into remission and you get into a recovered state. And so your stress and the dysfunction associated with that decreases over time. And then the third line is delayed. And that's someone who's diagnosed with some type of a condition, has some type of an adverse event. And it's stressful today, but the onset might take a little while to hit. Something, let's say, I mean, it could even, that line could fit someone with a cancer diagnosis, also somebody with ALS, where you begin to have more, you get closer to the end and you realize that that things aren't going to continue in a positive manner. But the most important line to me on this list is the bottom one, that's this dotted line, resilience. So what this shows is the people who are high in resilience, when an adverse event happens, their response is a healthy response. It's not too traumatic to them. Their health dysfunction doesn't go off the charts. They don't get severely depressed, become very apathetic, have a lot of stress in their lives. They just have a response somewhat like, you know what, life is short. We're all going to experience adversity in life. This is mine. How do we deal with it? And I think that the reason that I show this is it's just another visual example of the value of having a resilient mindset or being resilient. So that's the only really technical piece that I'm going to share with you guys today, but I thought it was valuable. What is going on with my screen here? Oh, there we go. All right, so adapting to chronic illness. I'm going to talk a little bit about the background of how we got to this place of resilience and positive psychology. There was a lady, Beatrice Wright, who was a rehabilitation psychologist. And what that is that's the area that I studied in. Rehabilitation counseling, rehabilitation psychology is really the looking at how do you help someone with a chronic illness and or disability adapt to their new way of life. That's a traumatic experience. It can be a traumatic experience and very anxiety provoking. And so Beatrice Wright was one of the pioneers in this field back in the 1960s, 70s, 80s. And she began looking at how chronic illness affects people with different illnesses. One of the main things that she's known for is this framework that looks at coping versus succumbing. And she says that people, when they are presented with something like a chronic illness or a disability, do one of two things. They either cope with it or they succumb to it. And what does that mean? Well, succumbing looks at emphasizing the negative aspects or the deficits associated with the illness. Saying that now that I have this condition, I'm no longer going to be able to do the things that I love to do. My life is over. Everything's going to be bad from this point forward. And you can hear, as I'm sharing that, the very negative, pessimistic outlook that one might have. And the other thing that's indicative of a succumbing individual is the one striving to be normal. And I put normal in quotes because I don't even know what normal is, right? Normal is very subjective, but trying to strive to make, let's say Parkinson's disease, and someone who doesn't have Parkinson's disease doesn't have a noticeable tremor. And maybe someone who has it does have that noticeable tremor, and they're always striving to hide their tremor and not let it be noticeable so that other people don't see it. And it does not having a tremor make someone normal or better? No, there's not a qualitative difference in that. And part of it is getting to the place where we can accept the situation that we've been dealt. So that comes to the coping aspect, which is obviously the better way to go. And it's focusing on what are the assets that you still have. We have an option to either look at what's lost or what's left. And it's certainly much more adaptive to focus on those abilities that we have left after we've been diagnosed with something, or whether after we've faced a traumatic experience. And there's also a change in values that takes place. And what I mean by that is, you begin most likely to find alternative meaning and realize that Parkinson's disease is only one aspect of your life. Frequently, when people experience adversity, they begin to kind of take stock in what matters to them in their lives. And they begin to look at interpersonal relationships, spend more time with folks whom you love. They begin to assess spirituality much more because, we begin to see our mortality is real. And sometimes that's a wake-up call to say, wow, there are some things that I've been neglecting that I should maybe start spending time doing. And so those are very adaptive ways of coping with adversity. And we know from the literature that people who cope versus those who succumb have better outcomes. And so I wanted to just present that because Beatrice Wright was well ahead of her time in what she understood about this coping succumbing framework. And really, it was a forerunner to what we now consider positive psychology. And some of you may have heard that term around. It's used a lot. And it's something I'm going to talk about briefly, just so that you kind of get an understanding of where all of this stuff comes from. And what it is, it's a scientific study of optimal human functioning. What is it in people that gets them to their best place, that helps them to be the most functional they can be? For many, many years in the medical community in particular, we were dominated by a medical model of chronic illness and disability, where the focus was always on the disease. And I've got pathology there. That's all that means is the disease state. And there were always conversations about, well, you have this condition, and these are all of the things that are deficits in your life. These are all of the symptoms, if you will, of that disease. And we focused on the negatives rather than spending time focusing on what the assets are. What are the things that you're still capable of doing? And what are the potentialities, those things that you can be able to do down the road if you work on it? So it's really an easy way to look at positive psychology. It's an optimistic outlook on the future, is largely what it is. What makes life worth living, right? That's what those who look at positive psychology are very interested in. What does it lead? What happens that makes someone happier, feeling more fulfilled? What about those who flourish, right? Those are the things that are really important in life, and the things that we should try to foster in all people. So what else here? And it's focused on positive emotions and individual strength. It's not a Pollyanna approach. It's not that we just say, let's just look at everything and life's going to be great. And even though I have this condition, there are positives. Some of it is that, but really it's more of an objective look at what are the things that you're still able to do, and what are the things that you would like to be able to do that could take a little work. the ultimate goal in positive psychology and in mostly, really most of the psychologies that you think about is the improvement in quality of life. What are the things that we can offer an individual that can help their life be better? And as an example, one of the things that's very common in people with Parkinson's disease is depression. And that dramatically affects quality of life. And so we have treatments for depression, right? There are not only medicines, there are psychological interventions that can help someone decrease their levels of depression. And when we do that, when depression goes down, quality of life goes up. There's an inverse relationship there. So I just give you that as an example. So that helps us. That gives us, hopefully, brings you guys up to speed very quickly on why we're going to talk about resilience. Resilience is clearly associated with the positive psychology movement. And we need to talk about, you've got probably all heard this word, resilient. Maybe you have a definition for it, but I'm going to go through several definitions and we're going to talk about what they all have in common and begin to look at what it is. So going back, it comes from the Latin word resiliere, and that means to leap back. And as we go through these definitions, I think you'll be able to see the significance of that Latin word. Effective, and so this is one definition of resilience: effective coping adaptation despite loss, hardship, or adversity. That's one definition. Another one is one's capacity to respond positively to adversity despite potential risks to health. That's number two. Number three, the maintenance or restoration of psychological and physical functioning when confronted with adversity. The process of negotiating, managing, and adapting to stress or trauma, the ability to bounce back, and the ability to adapt to stress and adversity. That's the American Psychological Association. That is the organization that most clinical psychologists and professional counselors are affiliated with. And so what I think they've done is they used a very short, succinct definition of resilience that includes the things that matter, right? So if we go back through this definition here and all of these definitions, what we see in common is an adaptation, right? We are having positive change. So we see the word adaptation, positive. The fourth one down is maintenance or restoration. The next one down is negotiating, managing, and adapting. So it's all about how do we change following adversity. So we've got, you see hardship, loss, adversity. So resilience is about how do I respond when confronted with an adverse event in my life. That's another way that you could think about this. And I'm going to show you this picture and we'll read this and then I'm going to use it as an analogy for you. So the strongest oak of the forest is not the one that is protected from the storm and hidden from the sun. It's the one that stands in the open, where it is compelled to struggle for its existence against the winds and rain and the scorching sun. I think that is a really good analogy for resilience, right? So you think about trees, young trees, saplings that are planted in a field, and they're all by themselves, and storms come through, and those trees bend down. They may sometimes almost touch the ground during the storm. When the storm leaves, they pop back up, and they're back to their pre-storm state. That is a crude analogy, metaphor for resilience, right? How does that tree can withstand something that's difficult, something that's challenging, yet still survive and continue to grow? And I think that's what we do as humans when we're confronted. those of us who have resilience. And there are some people who don't, just to be sure. And resilience is something that can be fostered and learned. And we'll talk a little bit about that as we go. But understanding those trees, it's important. So another way, as we're talking about this tree analogy, is thinking about a tree that is that's plugged in an environment where there are a lot of other trees. There might be some hills and valleys that help to protect that tree from the storms. The same thing is said with resilience. If you have a good social connection and you're in a positive environment, it can help foster resilience in your life. So, think about that tree being protected, and that's kind of what we're going to talk about moving forward today as we go. So I just threw together this word puzzle here with all of the words that I've read, that I understand are associated with resilience. And if you're familiar with how these work, resilience is in the middle, and the bigger the word is, the more it's associated with resilience. So I see the things that pop out to me are adversity, adaptation, process, positive, ability, right? So those are all positive things, aside from the adversity piece, but that's just the necessary piece so that we can actually go through the process of being resilient. So I just thought that was interesting to be able to look at all of these related terms. So what's the bottom line? The two necessary components of all resilience definitions are adversity and positive adaptation, right? You've got to have both pieces. There's got to be some precipitating factor, a diagnosis that happens, anything that you can think of that's an adverse event that you've dealt with in your life, and then how you've responded to it is the adaptation piece. And for resilience to be there, the adaptation needs to be positive. There are ways that people deal with adversity that aren't positive adaptation strategies. Alcohol and drugs is a common one. I've spent some time learning about people with traumatic brain injury, and that's a real issue in that population in particular. And that's a way of coping with an adversity. Excuse me. But it's not an adaptive way of coping with adversity. So it's important that we consider the positive change following the adversity. So that's a little bit about resilience. We're going to talk more about that, but I also want to mention post-traumatic growth because they're intricately entwined with one another. They're very similar concepts with only a slight difference. So post-traumatic growth is positive psychological change or growth following an adverse experience. This is really what differentiates the two. Whereas resilience is a return to pre-adversity baseline psychological functioning, post-traumatic growth may result in growth. So our bodies as humans like a state of homeostasis where everything remains the same. We have normal functioning. Something happens in our body, we get an infection and our body temperature rises. That's a signal that something's off. We've got this homeostasis. It's not working correctly. And our bodies want to fight that and return to this normal, if you will, state. And so imagine the tree analogy that I gave you, and that tree that is in a field all by itself. And every time a storm comes through, gets bent to the ground and pops back up, gets bent to the ground and pops back up. Over time, that tree is going to develop to become exceedingly strong. And because of what it's had to go through. It's kind of like analogous. Another analogy is lifting weights or exercising, right? You do it and you have a breakdown of muscle tissue. And After that, that muscle tissue heals and grows bigger and stronger than it was previously. And that's an example of post-traumatic growth. So resilience is a return to pre-adversity functioning. Post-traumatic growth means that you've actually become better in some regards than you were before the adversity. And we're going to explain that a little bit more as we go. Flourishing despite suffering is a way to put it. And we're going to talk a little bit about that. There are a lot of examples in the literature, especially chronic illness and disability literature about this. We're going to talk a little bit about Viktor Frankl, who is a very well-known figure in the meaning of life world. So we'll talk a little bit about him in a second. But in post-traumatic growth arena, we look at your life gets re-examined after you experience some type of adversity. And there are 4 different things that people begin to consider. And they begin to look at their personal strength. You know, coming through something, a diagnosis with a chronic illness. Let me get a drink here. Being diagnosed with a chronic illness is a form of adversity, right? And after you deal with that, you kind of go through it. You talk with your doctor, you talk with your families, you maybe talk with some other people who have a similar diagnosis. You begin to see that there are strengths that you have, and you begin to focus on those things that you still have rather than the things that you've lost. You begin to look at relationships in a very different way. And I've got the 2 asterisks there. Relationships is a huge thing to be considered for both resilience and post-traumatic growth. It's one of the things that is recommended for people to do better in recovery following some type of adversity. You know, frequently you get a diagnosis, something bad happens in your life, you lose a loved one. We begin to reevaluate what matters in life. Excuse me, got something in my throat. We reevaluate what matters in our lives. And some of those things that are the most important are our personal relationships, those whom we love. And we begin to think, well, have I been spending enough time with those people? What do I need to do differently now that I'm in this new place? Those who score high in a post-traumatic growth inventory have a new appreciation for life. They've made it through something difficult, and now they view things differently. They may begin appreciating nature in a way that they never did before. They're looking at life through a new set of glasses, if you will, and things begin to look differently. We also know that they begin to look at their spiritual lives. Part of all of us, right, as we age and we begin to be affected by different illnesses and traumatic events, adversities in life, I think we begin to see that time is limited. And we begin to come face to face with our own mortality. And a lot of times when that happens is when people begin to look at the spiritual and figure out, if you will, what it is they believe, why they believe it, who they believe in, all of those things, and really begin having a little different outlook on life from a spiritual perspective. And then they begin to look at new possibilities. Maybe active in areas that you weren't active before. You know, I think about, you guys all probably know the name Kevin Choi. He's a guy who was diagnosed YOPD many years ago. And when he was diagnosed, he was overweight, he wasn't healthy, and ended up at one point actually holding his son and fell down the stairs. And that was something in his life that changed. And he said, I've got this disease of Parkinson's disease now. And it's important that I take the best care of my body that I can so that I can be the best dad I can be to my son. And so he did. He started exercising religiously. In fact, he has appeared a couple of times on the TV show. Shoot, I just lost the name of it. I watch it too. American Ninja Warrior. is a competitive show that's on TV, and he's been on there, and they talk about his Parkinson's disease. You can see his tremor as he's getting ready to begin this obstacle course. And so that's an example of new possibilities. You know, through his adversity, he made changes in his life and found some things that he may not have ever dreamed of doing or thought he could do, but now he's actively engaged in something different. And the last one is meaning in life. And you'll see commonalities between all of these things. Meaning in life is also associated with beginning to appreciate, if you will, your own mortality, and beginning to think about what matters, beginning to think, what is the meaning in my life? What gives it meaning? And so these are areas that for people to thrive after having some type of suffering are important. And these are areas that almost everyone begins to address at some point. So flourishing through suffering. I mentioned Viktor Frankl a second ago. This is Viktor Frankl was a neurologist who lived in Austria during the First World War and was a Nazi concentration camp. And his whole family died as he was taken away. They were all taken on different trains, and he lived. And the whole time that he was in Auschwitz, he was thinking about what is it that makes the difference between the people who live and those who die. And his conclusion was someone who has meaning, something to look forward to, a significance in life, a life goal, if you will, or a purpose. Those are the people who were able to endure. And you know, he and Nietzsche, Friedrich Nietzsche, they both use the same quote, same wording, that if you understand the why, you can experience any how. So if you understand what your beliefs are, why you're dealing with things in life, you can handle any struggle. And that's the basis for understanding meaning in life. And Frankl talks about having what he called tragic optimism. And it means looking, even though tragic circumstances happen in our lives and we have these adversities, looking at it through an optimistic lens, focusing on those things that we still have, the benefits that we have in our life. For him, it was while he was in the concentration camp, he helped his fellow prisoners, and he would talk to them about their issues and helped them continue to try to find purpose if they didn't have it. And he believes that that was the difference. And so there might be nothing inherently good in the suffering itself. It may be possible to extract something good from it. Right? If you follow that's kind of what Frankl's saying. Is he's not saying that the suffering itself is good, that you're supposed to just say, well, this is really not a big deal. I'm diagnosed with Parkinson's disease. Yeah, it's fine. I don't think that's a realistic response. I think that it's real to call it what it is and say this is a difficult thing and there are some challenges associated with it. However, what can I take from it moving forward? What are the areas of my life that I might begin to look at differently as a result of this adversity? And so stressful events are likely to shatter one's assumptions about self and the world, which necessitates new meaning. We begin to, when something happens, give an example of, someone who, I talk a lot about young onset because they have a lot of different issues. And I've got a friend here in Texas who I talk to regularly. And he talks to me about, he says, Brad, I was diagnosed with Parkinson's disease at 38. And he said, at the time I had a great job, 2 young kids, a wife, everything in life was going well. Diagnosed with Parkinson's disease, I was in denial. I didn't deal with it. And over the next couple of years, I began to be confronted with some of the symptoms of Parkinson's disease that I couldn't avoid, right? If you have a tremor, it's going to gradually begin to show up, whether you want it to or not. He began to have some cognitive issues. Depressions sunk in. He ended up leaving his job. And so you can imagine from his perspective, everything in his world just changed. He was the primary breadwinner at home. He was the man of the house. He was a dad that played with his kids all the time. And some of those things began to change. And he was forced to look at his meaning. And interestingly enough, after several years of kind of struggling through with depression and apathy, he came out on the other side, and he actually started a lawn mowing business where he would have people who had other chronic illnesses help him, and they would mow lots for those who were elderly and couldn't do it themselves. So that was one of his meanings, was helping others. He's actively involved in working with other people who have Parkinson's disease. New meanings are created. One's view is reconstructed. So it changes the way that we look at things. So now I've kind of given you the general background, and now we're going to quickly just go through what are the factors that are associated with resilience and post-traumatic growth. Personality, right? That's one of the things that pops up first. Are people genetically wired to be resilient? Yes and no. It's a terrible answer to a question, but it's partially true. Optimism is believed to be one of those trait characteristics of people. And there's a difference between a trait and a state. Traits are those things that are kind of hardwired into someone. States are, someone who might typically be pessimistic, but in a given situation, they might show some optimism. That would be in a state. In a certain area, they show optimism, but it's not really part of who they are. And I mention optimism because it's essential in resilience. And dispositional optimism is significantly associated with resilience. So if you have that, if you are optimistic by nature, you've got one component in your favor for being resilient. And really, though, resilience is better described as a process rather than a static trait. It's something that people can develop over time. Stress inoculation. The more you're exposed to adversity, you can find some untapped resources that you've not found. It doesn't mean that those who have gone through a whole lot of adversity are automatically more resilient. It's those who have gone through adversity and have found some of these resources within themselves to thrive. Then the next time they experience it, they've got those resources, they use them again, and then maybe they find some more. So they kind of grow on each other. And that's just what that last bullet point, repeated exposure predicts more positive mental health and well-being. Going on to some more social support. I gave you that example with the tree. People who have more social support are shown to be more resilient, both in community and family relationships. And it's really quality over quantity. It's not necessarily people who have 500 friends. It's someone who has 3 or 4 really good friends whom they can count on at any time. Engagement in physical exercise. Those who engage in exercise are shown to be more resilient. Now, this is what's called a bidirectional relationship. Those who are resilient also exercise more. So it's not just one way or the other, right? So those who exercise are more resilient, but those who are resilient also exercise more. So we've got to consider it could go both ways. Positive emotions are associated with resilience. Hope, optimism, the benefit finding we talked about. Gratitude is something that's largely neglected in the literature and the research on positive outcomes. It is very difficult to have a negative attitude when you have an attitude of gratitude. Those two things are mutually exclusive. So gratitude has been shown to be very effective. We talked a little bit about spirituality. Clearly, there's a relationship between spirituality and resilience. I don't mean religiosity. Those are two very different words. They can be interrelated. Someone could have very high spiritual beliefs and they're also very religious. But there are plenty of people who have high spiritual beliefs who aren't overtly religious in their behaviors. Independence. Can I function on my own? Doesn't mean total independence, neglecting all other relationships, right? But it's that I can function pretty well on my own, and I have that sense of self, which goes right in with self-esteem. Those who believe good things about themselves and their abilities are more resilient than others because they begin to think that they can do it. Those who have adaptive coping skills. The two major coping mechanisms that people have are avoidance and approach. I'm not going to go into in detail on those, but approach avoidance is going toward your problem, going toward the adversity, addressing it, and doing what you can in spite of it. And that people who cope that way are much more resilient than the people who avoid it and just kind of say, well, yeah, I got a diagnosis with Parkinson's disease. It's not that big of a deal. I don't need to address it right now, and may begin to use more of a denial. The other thing that's interesting is those who have reduced stigma or negative perceptions of PD are also shown to be more resilient. So it's when you don't look at yourself and say, wow, I've got PD, my life is over, it's an awful disease, people aren't going to accept me because I've got this tremor. It's really when you begin to say, this is just, it's not who I am. It's a part of who I am, but it's not my identity. Internal locus of control. It just means that you make decisions for yourself and that you don't necessarily take on the opinions of other people who may think something negative about an individual who has a tremor, let's say. So the end all be all question for everything I've gone through is, so what? What do I do? How can I become more resilient and foster post-traumatic growth? The first one and the most important one is establishing positive relationships and social support. PD support groups are essential. I know for many, it's been a real challenge through COVID. I wrote a paper got published early this year looking at that, how COVID has affected all aspects of Parkinson's disease, and relationships and the social piece is one of it. Loneliness is a big problem. So I encourage you to be involved if you're not. I mean, those of you that are here are clearly involved in a support group. Talk to each other outside of groups. Talk about successes. Talk about the things that are going well in your life. That should be your priority. That's the one that's bolded there. If I could give you anything to take away from this today, the most important thing you can do is foster social relationships with other people. Getting enough sleep and eating well. I mean, that's every time you see your doctor, that's what they're telling you to do. Those are two essential things to well-being, and they're also essential here. Active optimism. Looking at, with the things in your life, is there a different way that you can frame and look at your adversities? Look at it from the bright side. How can I take what I've been given and make it a positive? It's kind of what Viktor Frankl was talking about, tragic optimism, right? Looking at it from the positive perspective. And I mentioned this earlier, practice being grateful. You know, there are exercises that I can give people to say, write down every day 3 things that you're grateful for and add to that list every day. And I've given that as an assignment before, and I had someone come back to me. I actually told them to write a gratitude list. And they came back to me the next day with a sheet of paper that was about half full. And clearly they didn't do a thorough job. And I helped get them started. And I said, you have 2 eyes, 2 ears, a nose, a mouth, 5 fingers on each hand, 5 toes on each foot. You can walk, you can talk, you can play, et cetera, right? So we all have plenty to be grateful for. And I would argue much more to be grateful for than we have to be upset and pessimistic about. So that's a brilliant way to increase positive psychology and resilience. And then if you wanted to go the formal route, cognitive behavioral therapy and acceptance and commitment therapy are two proven interventions that are highly effective. Self-regulation skills, beginning to use mindfulness if you're not familiar with it. It's really just a form of meditation to help you stay present in the moment. I give you a variety of things here that are free that you can get on your cell phone, and there are ways that you can practice mindfulness on your own. Increasing self-efficacy, meaning I can do it. Some of it's the way you talk, saying, not instead of saying I can't, say I haven't done that yet. Setting stretch goals that challenge you, trying new things, accepting failures as a positive. Instead of saying I failed, say I learned something different. Increasing meaning in life, finding areas that you enjoy and engage in them more. Collaborate with others in chosen areas and share experiences with them. The people in your support group, share different experiences with each other, things that have worked, things that have been successes. And creativity is the last one that's been shown to be associated with resilience. Painting, just finding something that you do that's creative. Last slide. A couple of quotes that are important to me. It's not what happens to you, but how you react to it that matters. Epictetus. He is a wise man who doesn't grieve for the things he has not, but rejoices for those which he has. And lastly, Maya Angelou. I can be changed by what happens to me, but I refuse to be reduced by it. So those are all just ways to change your mindset. And that's really the one thing that will help us with resilience. So I went longer than I anticipated. I'm sorry, but I'm open to questions if you have any.
Yes, feel free. Thank you so much, Dr. McDaniels. Feel free to unmute yourself and ask a question, or you can type it in the chat box.
Happy for anything, even if it's not resilience related. I'm happy to address it if I can. Hey, look at David's got Man's Search for Meaning right in front of him. Outstanding book. I strongly encourage, if any of you like to read, to get it. It's a life-changing book. It has been for me, and anybody that I've known who's read it. David can probably speak to the value of that book and the.
Yeah, this was great. And too, since my recent diagnosis and surgery, it's important to surround yourself with the right people. I would say also those that encourage and motivate you rather than want to bring you down all the time.
Yeah, I agree. It's critically important. Yeah, and I just encourage those of you who are active in this group, find ways to be even more active. Talk to one another and talk about the things that have worked. Because sometimes we learn best from others, right? Someone says, hey, I was struggling with this problem and this is what I did and it got better. And I go, wow, I never thought about doing that, but I'm going to give it a try. I heard a guy say once that we always learn from experience, but it doesn't have to be our own experience. And I like that. So it's a thing to think about. Someone asked for a copy of the slides. I'm happy to give them to you guys. Casey, I'll send those to you and you guys can send them out, do whatever you want with them at that point. I'm happy to share that stuff.
Thank you.
I see a question. Christine, how does humor play into resilience? I think I've not seen any data on that, Christine. I would suspect that just from what I know, people who use humor are largely optimistic in nature and they're social in nature. So those two things that are associated with resilience and humor, I think would be a plus. So I think that it helps us not take life quite so seriously. So I think it's a great option. That kind of fits under the creativity component, if you will, from my perspective, but great question. Anything else?
Also, if you have comments or would like to share your thoughts or what has worked for you, what hasn't, we have a few minutes.
Yeah, it's always good to hear from those of you who are experiencing PD very differently than I have. I haven't experienced it myself. I've experienced it vicariously through my mom. And those are two very different perspectives. I have the outsider's perspective, right? And what's one of the areas that I think is critical in my own research is asking what needs to be done from your all's perspective. I see Karen, gratitude list has helped me a lot throughout. Yeah, the literature on gratitude is really solid. And it seems really simple that you think, really, how is that going to help me? But it is extremely effective. And it's just something, is, like I said, as easy as writing down 3 things when you get ready to go to bed at night, 3 things that you're grateful for. And that's it. That's all you got to do. And doing that day after day begins to program your mind to pay attention to things that happen in your day that are positives instead of focusing on the negatives. It's take a sheet of paper and on one side list everything that you're grateful for, and the other side all the things that you're struggling with. I can promise you which side of that page is going to be longer. In every person I know, no matter what you've experienced, that gratitude list is always longer, and it's just a matter of which list am I going to focus on. And that's the positive psychology spin, if you will. It's not really a spin, it's a perspective that we just change the way that what do we focus on. So
I've got a comment, Steve Jackson.
hey, Steve.
I can sing better than I can talk, so I'm going to sing it. One of the things that I like, that I do, is to help people. At the support group, I'm in boxing. I've kind of looked at it that why do I have this disease? Why do I have this disease? And I look at it and I say, maybe I got it to help people. And by helping people makes me feel good. I can see in PD2, which is the boxing group for people who have more disabilities, I can see, I stay from PD1 to PD2, and they're very appreciative, and I can see results. And I look at, why did I get this disease? Maybe I got it to help people. So looking at that respect, anybody that feels that they have a negative in that regard, help somebody and it'll feel a lot better. That's it. Amen. I'm done.
Yeah, very well said, Steve. That's another really big piece. Is not asking why me, but what about why not me? What do I have to be able to give someone else? And it's critical. That's another piece of the support group, right? Being a part of and offering, how can I assist someone else? So thanks for sharing that. That was fantastic.
Okay.
Kind of along those lines too, I think about Michael J. Fox and someone like Davis Finney, who had incredible careers prior to the diagnosis, but at least in my opinion, they've done so much greater things after the diagnosis than in their, former careers. Look how many folks Michael J. Fox has helped and encouraged, and the same with Davis Finney. And they were very successful in what they did, but they almost reinvented themselves.
Yeah. And that's a great example of post-traumatic growth, right? They're involved in things they weren't involved in before their diagnosis. And after they were diagnosed, they reevaluated their life and they began to look at what matters and they begin to focus on some of these other things in an altruistic way, both of them, saying, how can I use what happened to me in a positive way? And man, they took off, and though both of those organizations are tremendous. They do a lot of really great work for everybody who's on this call, because we're all affected by PD one way or another, or we wouldn't be here. So great point, David.
And you are all gifts, and you all have gifts to share.
Absolutely.
Any last comments or questions before we can conclude?
Brad, I have one. I'm grateful to our team for bringing up the topic of resilience and engaging you yet again. Are there other topics that you specialize in that you think would be helpful for us?
You know, the one that I've done recently, and I didn't do it yet with you guys, would be meaning in life. I did that with PMD Alliance. Indu Subramanian's a good friend of mine, and she invited me on there a couple of months ago. And that's a topic that's near and dear to my heart, simply because meaning in life, I believe, reduces apathy, which is another research area. And those who have higher meaning in life are going to also be more resilient. So that's kind of the core piece that I believe that, as all of us, whatever your life situation is, the more meaning in life you have, the better you function as a human being. I believe there's no question. So I'd be happy to come back and give a talk about meaning. How do you find it? How do you cultivate meaning? How do we lose it, right? We have a meaning in life, and all of a sudden something happens, and wow, it's changed. And so I'd be happy to do that anytime.
Okay, we'll be contacting you.
Yeah.
Good that could be our first webinar of 2022. Yep.
Send me a message. I'm very adaptable, and you guys let me know when you want to do it, and we'll make it happen.
Okay.
That's a great way to start the year, right?
Yes. Yeah. And a great way to conclude our webinar series for 2021. Thanks for all of your participation, and special thanks to Dr. McDaniels.
Yeah,
thank you, guys.
I can't thank Casey enough for all that she's done in my absence. She's really kept things moving forward, probably at a better pace than I did. So, yeah, big hand for Casey.
Thank you. We're
grateful for you both.
Yes. Yep. Grateful for you, David, and everyone have a nice holiday season if we don't see you, and we'll see you next year.
Yeah, absolutely.
Thanks, everyone.